To sleep, perchance to dream, so Shakespeare said. Yes, people with ADD have more trouble than people without ADD in going to sleep. Stay tuned. Here's why. Hi, this is G.H. Glade for Coaching ADD and the Stimulus-Driven Brain. Sleep problems are all too common for people with ADD. It seems to go with the territory. And, like many things, ADD seldom is just one set of symptoms. Now, the first thing to know about sleep is it's driven by circadian forces. Have you ever been camping and it's 9 o'clock at night and you're sitting around the campfire and it's getting dark and all of a sudden you feel really sleepy, like it's bedtime, even though you never go to sleep at 9 o'clock? It's those circadian forces. We live in a world surrounded by artificial light, and light is the switch that turns sleep on and off. And oftentimes we spend our time in front of screens that give us that blue spectrum light, which is particularly potent in making it harder to sleep. But the same forces that make ADD difficult are the same ones that make sleeping difficult. People with ADD have busy brains. They are just going all the time. And that plays out in certain sleep disturbances. There are four main types of sleep disturbance for people with ADD. Number one, it's an onset disturbance. People can't shut their brain off to go to sleep. Perhaps this has been you, where, as one of my clients put it, I go into monkey mind, where my mind is just into everything and picking up and holding nothing for very long. It's a common experience, and I find that this is easily true for half of the people I treat with ADD. Another aspect of that, number two, is restless sleep. You just can't settle and go into deep sleep. Now, the rule out for this is sleep apnea. People often think that snoring is the indication for sleep apnea, but it's actually not the best indicator. In fact, a person can have sleep apnea and not have the classic snoring, stopping breathing pattern of really severe sleep apnea. It winds up not allowing you to get any kind of depth, because as your airway closes off, your oxygen blood level drops and the brain goes into alarm mode and it says, help me, and you come to wakefulness where you can take control of that. And you may not wake up fully, but you never get really deeply asleep. Number three, difficulty waking up. I wish I had $1 for every person who told me that, gee, I just can't get out of bed in the morning. I use multiple alarms and morning is so difficult. Part of that is because people stay up too late. It's best to have a set sleep time and a set waking time and not disturb those at all. The other aspect of that is you tend to hit this really deep cycle when you've had restless sleep and you just haven't gotten the rest you've needed to overnight. It is a common problem and one that people struggle with. And this is not to say that we don't have a chronotype. A chronotype really revolves around the time where we feel most wakeful. There are people just designed to be night people and other people designed to be day people. They are the owls and larks of our world. And then there are other people referred to as porpoises. God knows why, but these people can actually change their pattern. I happen to have been one of those people. Number four, intrusive sleep. This is often a question I ask when I'm first interviewing somebody. Do you often get sleepy when you're trying to read something or do a hard project? These are the rhythms that are present during our normal level of alertness. So why do ADD people have sleep problems? There are lots of different theories, and many people blame stimulants. There's an interesting thing about stimulants. Low blood or serum levels of stimulants make about 15% of people sleepy. And I find more often than not that people report to me, I sleep better on these meds. The interesting thing is the low blood level is just enough to calm down that rapidly moving brain during onset. In fact, there are some clients I give a teeny tiny dose of an instant release stimulant to go to sleep. Doesn't that seem paradoxical? The theory that I like the best is that the circadian rhythm clock is messed up, and our lifestyle does everything to enhance that. The easiest interventions are things like sleep hygiene. We build associations to place. And if you ever meet with a group of people in the same room time after time, you know everybody has their chair. There's no name on the chair, but everybody knows this. Basically, sleep should be left for two activities, both starting with S, and I'll let you guess what those are. You should avoid long naps. A 15 to 20 power nap is rejuvenating, but more than that generally fails to have you go into a full rhythm. But a small nap can be a really good thing. Let's talk a little bit about medications for sleep. There are the typical Ambien, Sonata, other ones. They have their use, but it's short term. These are like the drug benzodiazepine. These are classic sedative medications, and they wear out very quickly, and people can become dependent on them. And some studies suggest that long-term use of these can actually lead to dementia. One of the first on my list is melatonin. Melatonin is actually a naturally occurring peptide that gets triggered into production by lower light levels. We can take this as a supplement about 40 minutes before we want to go to sleep. The downside I find with this is for some people it has a hangover effect. Another medication I like is something called Periactin. It's an antihistamine, but it's not as harsh as Benadryl. It too may have a little bit of a hangover effect. And the downside of this one is that it's a pretty good drug if somebody has appetite suppression, but that same double-edged sword can cause people to gain weight, which is rarely, if ever, a good thing. Another old school med that I like for sleep is something called clonidine. It's used in very low dose uh, for sleep. It has about a 4-hour active time. It's an old school blood pressure med, and you have to be careful of getting lightheaded when you get out of bed. We are a gravity influenced hydraulic system. And when we stand up, our blood goes to the bottom and it leaves the top, our head. And without blood in our head, we get lightheaded. And I coach people in how to transition to standing. Do not start walking right away. I hate to see people wind up flat on the floor. There are antidepressants, and these are not drugs of choice for people with bipolarity spectrum disorders. The old school one is trazodone. It's an old antidepressant that is not serviceable as an antidepressant. The dose needs to be too high for it to work as an antidepressant, but at lower dose, it can be effective for sleep. Drawback, sometimes it has a hangover effect too. Another medication I like is Remeron or mirtazapine, typically used at 15 milligram doses. This is subtherapeutic for depression. The irony about Remeron is it's more sedating the lower you go in dose. And these are some options to discuss with your healthcare provider. One of the best interventions on sleep is exercise. This really is crucial for a lot of people in terms of sleeping. And by exercise, I mean aerobic exercise. You got to get your heartbeat up and moving. Well, this has been a short journey into the problems of sleep for people with ADD. If you like this presentation, go ahead and hit a like for me. I appreciate that. Better yet, leave a comment, and still better, share it. Share it with other people who you may know that are having trouble sleeping. it may afford them some benefit to just know a little bit more about it. Until next time, this is G.H. Glade for Coaching ADD and the Stimulus-Driven Brain. Take care.